Hi, I'm Marion McNeil, and I'm a member of the Anti-Fish Poverty Coalition. So I have a question here tonight for our candidates related to health services. There has been much talk during the campaign regarding the consolidation and centralization of district health authorities. The Guys for Antigonish Strait Health Authority, headquartered in Antigonish, provides the people of Antigonish community high-quality health services which are directed to specific needs and aspirations of our community. For instance, public health has sponsored unique initiatives to reduce economic and health disparities, and mental health services have developed programs to meet specific culture and social needs. Furthermore, the employment of local people to serve their friends and neighbors provides essential jobs that stay in our community. Acknowledging that it is important to make efficient use of limited resources to deliver effective healthcare services, can candidates please comment on how the loss of the Regional Health Authority will affect the level and quality of health service to Antigonish area, as well how the loss of this major employer will impact on our local economy?
For us, because we have a local board here in this community, we're able to tailor the decisions we need to make for this community, in this community. And the alternative to reducing the number of boards or cutting them down to 1 or 2 or 3 is just not a practical thing as I see it. We've had some other people talk about this, notably Dr. John Ross, who is a emergency care doctor in Halifax. He basically was the doctor who gave us his report on the emergency care centers in Nova Scotia, and he's a well-respected person. He basically says that to reduce these health boards is just really tinkering with issues that aren't necessary to do. The saving of getting rid of the health boards would effectively save the amount of money that one day of services from doctors, nurses, hospitals, clinicians, testing gives us. So we're talking about doing away with a system that's working in order to save one day's worth of income or of cost. The cost of doing that is going to be prohibitive. It's been tried in Alberta. It didn't work there. It was tried before in Nova Scotia by previous government. It didn't work at that time. I'm suggesting that it would be cost prohibitive and as well a loss of jobs in our community. So I want to say that we're totally against, and our government will not, an NDP government will not adjust or cancel these boards.
As a member of the healthcare profession, I see some of the things that we see in the frontline care and what patients have to go through on a daily basis. In my practice as a physiotherapist, I often see the wait times that people face because of reduced funding. Now, what happens with that is it costs everybody in the long run. So if we have a wait time to see a specialist, or wait time to see your own family doctor, or a surgery, or this and that, anything at all that you come across, it costs everybody. It costs the system, and it delays the inevitable from happening. Now, what Jamie Bailey and the PC plan does indicate that there is savings to be had, and the savings total is $60 million. Now, the $60 million is going to be redirected into frontline care, and if you talk to anybody that works in frontline care, they need the help and need the assistance. So if we can streamline some costs associated with some of the administrative duties within the district health boards themselves, that is something that with the technology we have today, there's always ways of streamlining those costs, but we're not taking money out of the system. It's basically making it more efficient so that the frontline services are there for everybody to take advantage of. And that is the plan really for the health care and the approach to health care. And we think it's a sound plan, and we think that patients, people going to the hospital when they're seeking those services, want to have those frontline services when they need them.
Well, our position, I think this is probably one thing that Mr. Thompson and I can agree on, is the need for some restructuring. But the issue here is not about the loss of jobs in Antigonish from this restructuring. The emphasis here is on the executive level. It's not about taking GASHA away as an organization and all of the employees that go along with it. It's about the fact that with the 10 boards that we currently have, there are 10 CEOs and about 133 vice presidents and directors making substantive executive level salaries. As Mr. Thompson suggested, we're able to leverage those savings from the executive boardroom level and redirect them to the frontline healthcare workers. So the fact is, there may be opportunity to invest in more jobs, but they're the jobs that are providing the healthcare services, not the administrative services at the senior level. With respect to the community decision-making process, which is also a concern with the notion of restructuring to have a board or two centered out of Halifax, our Liberal position is to have 4 management zones where community-based decision-making still takes place. The regional and community-based decisions are still going to be influenced by the community health boards. The individual hospitals with a more flat management structure will have more autonomy and authority to make local site-based decisions. These are very important changes that will help improve the efficiency and the effectiveness of our healthcare system while ensuring the maximum amount of funds can be directed to the healthcare services, not the administrations. We want to invest in emergency rooms, not corporate boardrooms. Thank you.